Centers for Disease Control and Prevention, National Center for Immunization and Respiratory Diseases. How nurses and medical assistants can foster support for vaccinations in pediatric and family practices. Disclosure. In compliance with continuing education requirements, all presenters must disclose any financial or other associations with the manufacturers of commercial products, suppliers of commercial services, or commercial supporters, as well as any use of unlabeled products or products under investigational use. CDC, our planners, our presenters, and their spouses or partners wish to disclose they have no financial interest or other relationships with the manufacturers of commercial products, suppliers of commercial services, or commercial supporters. Content will not include any discussion of the unlabeled use of a product or a product under investigational use. CDC did not accept commercial support for this continuing education activity. Objectives. Describe strategies nurses, medical assistants, pharmacists, and other healthcare professionals can utilize to foster a culture of immunization, where all members of the practice work together to successfully communicate with parents and patients about childhood and adolescent vaccinations. Describe the burden of vaccine-preventable diseases and the benefits of vaccination, including the role of vaccination in keeping children healthy. Describe how to deliver clear and concise vaccine recommendations for boys and girls ages 0 to 18, including flu vaccine during flu season. Describe strategies to improve competence of healthcare professionals around addressing parental concerns regarding childhood and adolescent vaccinations, including how to handle conversations during outbreaks. Increase awareness of resources to facilitate vaccine conversations with parents.
Hi everybody, I'm Andrea Polkinghorn and I'm the Enterprise Immunization Strategy Leader at Sanford Health in Sioux Falls, South Dakota, and a registered nurse.
And I'm Virginia Chambers. I'm the Department Faculty Chair and Program Director for the Medical Assisting Program at Portland Community College in Portland, Oregon, and a Certified Medical Assistant.
Thank you for joining us for this program. Today we're discussing the role nurses and medical assistants can play in fostering support for vaccination in pediatric and family practices. We'll talk about the importance of educating patients on vaccination, best practices for answering questions about vaccines, and steps you can take to help foster support for vaccination in your practice.
The importance of fostering support for immunization.
So why is it so important to support vaccination in your practice or office? Because parents may be getting inaccurate information elsewhere, and they may not understand how important vaccines really are. Parents love their children and want to protect them, but in many cases, they don't understand the real risks of vaccine-preventable diseases. They may not understand that these diseases still exist and pose a very real threat to their children. They may not understand that these diseases can lead to hospitalization and even death.
That's why it's essential for babies, young children, preteens, and teenagers to receive all vaccines on schedule. Children are vulnerable to serious and life-threatening diseases. On-time vaccination provides the best protection against these diseases as early in life as possible. Here's an incredible statistic on the estimated impact vaccines will have on children born between 1994 and 2018. Over the course of their lifetime, vaccination will prevent an estimated 419 million illnesses, 26.8 million hospitalizations, and 936,000 early deaths.
And healthcare professionals are essential to making that happen. While many parents do get vaccination information from the internet, social media, or friends and family, they still list their healthcare professional as the most trusted source of vaccine information. A recommendation from their child's healthcare professional is the most important factor in a parent's decision to vaccinate.
And this includes everyone, nurses, medical assistants, front desk staff. It's not just the physician's responsibility.
That's absolutely right. The specific role nurses and medical assistants plays varies from practice to practice and state to state. In some cases, medical assistants may talk to parents about vaccines or even act as vaccine coordinators. In other instances, medical assistants may have specific requirements that limit them to sharing information from pre-printed material. Whatever your role is, you can help support vaccination.
Nurses and medical assistants are often the first healthcare professionals to meet with the parents and patients during the visit. We set the tone for the visit, and we are often in a position to ensure the practice doesn't miss any opportunity to vaccinate. In many cases, a parent may feel more comfortable talking openly with the nurse or the medical assistant than the physician. They may relate more to us, or they may feel less intimidated about asking questions. That's why it's very important for nurses and medical assistants to understand the importance of vaccines themselves and be ready to talk about them. Parents can sense when you're not confident in what you're saying, and they may interpret that as you having your own concerns about vaccines.
So what should nurses and medical assistants know about vaccines for children?
First, it's important to know what vaccines children need at different ages. It's very important children receive vaccines on time. The recommended childhood immunization schedule is carefully designed to provide protection at just the right time.
Test your knowledge. Vaccinating children according to the recommended immunization schedule helps protect them against how many diseases before the age of 2? A, 3, B, 10, C, 14, D, 5.
Before age 2, vaccines protect children from 14 serious diseases: varicella or chickenpox, diphtheria, influenza, hepatitis A, hepatitis B, Hib disease, measles, mumps, pneumococcal disease, polio, rotavirus, rubella, pertussis or whooping cough, and tetanus. Parents should understand that children need more than one dose of some vaccines to build up immunity and provide protection. Other vaccines need regular booster doses to build up immunity that weakens over time. And annual doses of flu vaccine are important as influenza viruses change over time.
Even parents who fully vaccinate their children in their early years may not be aware of vaccines for preteens, or they may have questions and concerns.
Test your knowledge. Which of the following vaccines is not recommended for preteens? A, meningococcal conjugate. B, rotavirus. C, HPV. D, Tdap.
Preteens need 3 vaccines at age 11 or 12 to protect against serious diseases. Meningococcal conjugate vaccine protects them from meningococcal disease. This disease can lead to meningitis, an infection of the lining of the brain and spinal cord, as well as bloodstream infections. HPV vaccine protects them from human papillomavirus infections. HPV can cause certain types of cancers in men and women. And Tdap protects them from tetanus, diphtheria, and pertussis, better known as whooping cough. Young children get the DTaP vaccine for these 3 diseases, but it's important that preteens get an additional dose to boost their immunity.
And everyone, 6 months and older, needs a seasonal flu vaccine every year.
Key takeaways. Nurses, MAs, and front office staff play an important role in fostering a culture of immunization. Vaccines protect children from 14 diseases by 2 years of age. Meningococcal conjugate vaccine, HPV vaccine, and Tdap are all routinely recommended for preteens. The role nurses and medical assistants can play in fostering a culture of immunization.
Everybody who interacts with parents and patients in a practice, including front office staff, has an opportunity to support vaccination. Nurses and medical assistants have an especially important role to play. First, nurses and medical assistants are often in the best position to identify vaccination opportunities. Before every visit, including sick visits, you can review the vaccines each patient needs by looking in your EMR and your state immunization information system. It's important to make sure your EMR is following the most up-to-date childhood immunization schedule. Someone in your practice should be identified as the vaccine champion. This could be the vaccine coordinator or another staff member. If you serve as the vaccine champion, you can set up standardized systems and processes to help all staff stay on top of which vaccines patients need. For example, you can set up reminder systems to help ensure patients are vaccinated on schedule. One approach is to set up prompts in the EMR. You can also make sure every parent is aware of your approach to immunization. For example, some practices have written statements that they post in their waiting room or give to parents when they join the practice. This is a great foundation for talking about vaccines.
If you serve as the vaccine champion, discuss the practice's approach to immunizations in staff meetings. Talk about the practice's commitment to vaccination and discuss how everyone can play their part. Be sure practice staff are prepared to respond to common questions from parents. Equip them with information they need and materials they can share with parents. This is especially helpful during an outbreak event when consistent messages are key to alleviating parents' concerns. Use reliable parent education materials, such as the vaccine information statements or other resources from the CDC or medical associations.
Also, make sure all staff reviews the recommended vaccine schedule every year so that they're up to date on any changes. It's also important to inform staff of any changes and recommendations throughout the year. CDC has educational resources for healthcare professionals to help them stay up to date. It's also important that staff know proper vaccine storage and handling procedures. Finally, make sure staff understands proper administration technique and documentation procedures after administering vaccines. When a patient receives a vaccine, it should be recorded in their medical record, in their personal immunization record, and in your state's immunization information system.
And whenever anybody joins the team, take the time to make sure they understand the importance of vaccines and how to talk about them. Remember that some non-clinical staff may not know a lot about vaccines or may be hesitant about vaccinations themselves. Don't assume they already know that it's important to support vaccination. Take the time in a judgment-free conversation to learn about their views. Then talk to them about the approach in your practice. When you're training other staff, it's helpful to present them with different scenarios and ask how they would react in that situation. They can be prepared for these conversations better by imagining how they will play out.
A practice's commitment to vaccination should be evident from the moment a parent walks in the door. At the beginning of the day, a nurse can go over the day's appointments with the front desk staff to let them know which patients need vaccines. Then at check-in, front desk staff can remind parents which vaccines are due that day. It's also important to ask the parents to complete a screening checklist for their child so that you can be sure you're aware of any contraindications to vaccines. Let's watch a short scene to see what effective vaccination practices look like.
Hey, Amanda.
Good morning.
Good morning. Here are your appointments for this morning.
Thanks, Keith. It looks like we have 2 patients coming in who will need vaccinations today. Michael McCall is 11 years old, and he's due for his meningococcal, HPV, and Tdap vaccines. Looks like he's up to date on everything else.
Okay, Amanda, I just put that in the check-in notes.
Please give his parents the contraindication screening checklist to complete while they're in the waiting room. Dr. Johnson will review it and confirm which vaccines Michael should receive today. And give them a copy of the vaccine information statements for all the scheduled vaccines. Ask them to read them while they're waiting to be called back. Sophia Foster's parents are bringing her in for her 2-month visit. Would you remind them that she's due for shots and an oral vaccine today? Give them a copy of the screening checklist and the vaccine information statements as well.
Sure, will do.
And can you check and make sure we gave them a copy of our immunization information materials for new parents when they were in last month?
Sure, I can add a note to ask them when they check in.
That's great. Thanks, Keith.
You're welcome.
What is this practice doing to foster support for immunization? What jumps out to you?
It's clear the clinic has an effective system in place to make sure staff remind parents about which vaccines are due. The parents already received information about the upcoming vaccines at the 1-month well child visit. This gave them time to read and digest the information before the baby's first shot visit.
I also noticed the clinic is distributing vaccine information statements, or VIS, for each vaccine before the parent even gets into the exam room. This gives the parents enough time to read and understand the VIS. The practice also has additional educational materials on hand to share with parents who want to learn more. The practice also established an effective procedure for screening for contraindications and precautions, which is an initial step in administering vaccines.
They've established an effective system for educating parents about vaccines their child will be receiving that day. And they put processes in place for engaging all staff in promoting vaccination.
Key takeaways. Put systems in place to ensure there are no missed opportunities to administer recommended vaccines. Give parents information about vaccines before the appointment. For example, before the first 2-month shot visit. Distribute vaccine information statements, VIS, before parents enter the exam room. Talking to parents about vaccines.
Along with putting effective processes in place, it's essential to have effective conversations about vaccinations with parents. Nurses and medical assistants often have the opportunity to start these conversations. When you meet with parents and patients at the beginning of a visit, take the time to explain what vaccines the child will be receiving that day. Explain why vaccines are important and be prepared to answer basic questions. Andrea, what are some best practices you recommend for starting these conversations?
Test your knowledge, true or false. Using the presumptive approach when introducing vaccines to parents can help increase vaccine acceptance.
Well, first, I like to use the presumptive approach. That is, when I talk about which vaccines the child needs, I assume parents will want to fully vaccinate their children, just like they want us to provide other routine care. In other words, I go into the conversation expecting the parent to say yes to vaccines, rather than no. For example, with parents of preteens, I say, your child needs 3 vaccines today: Tdap, HPV, and meningococcal vaccines. Parents look to healthcare professionals for guidance. Using a presumptive approach lets parents know that vaccination is a routine part of protecting a child's health. Starting off by asking the parents what they want to do about vaccines, called a participatory approach, is less likely to result in vaccine acceptance than approaching vaccines as a standard routine part of the visit.
That's right. There was a study in 2015 that compared the results of these 2 different approaches. In the study, almost 90% of parents accepted all recommended vaccines when healthcare professionals used the presumptive approach. But only 16.7% accepted all vaccines when healthcare professionals used the participatory approach. How you phrase recommendations can make such a difference. I like to say the child is ready for a vaccine. For example, it looks like Paul is ready for his DTaP and his polio vaccine today. That frames it as something to be excited about, another important milestone for their child.
Sometimes parents have questions about vaccines. I take time to learn more about their specific concern. When you talk it through and really take the time, you can start to understand what's on the parent's mind.
Yes, it's so important to listen. I listen to the parents' questions and concerns calmly, respectfully, and without judgment. Parents can sense when you're judging them or assuming something about what they believe, and then they don't want to talk, or they make it defensive. When a parent says they're concerned about vaccines, don't assume you know why. It could be concerns about safety. It could stem from religious beliefs. It could be concerns about specific additives. They may be nervous about their child being in pain. Or it could be they're simply anxious because they just don't know what they don't know. You can share what you hear with the provider to help them address the parents' concerns. You can also share educational handouts.
In the VaxChamp program at Sanford Health, we teach the importance of finding common ground. Let the parent know you understand their interest to learn more and that it's natural to have questions about vaccines. Then you can share a bit about you. Talk about your expertise and what you've done to learn about vaccines.
In a completely open, judgment-free conversation, you can hear what they're really worried about. Then you know what questions to address. For example, if a parent is concerned about safety, I explain the immunization schedule for children is developed based on extensive research and testing. I'm also careful not to bring up things the parent hasn't already asked about. It's much clearer for the parent if you focus on their actual concerns. For example, there's no need to bring up myths about vaccines causing autism if the parent hasn't asked about that.
That's right. And you don't need to bring up that HPV can be transmitted through sexual activity if a parent hasn't asked about it. Focus on their questions. Another important point is to be aware of your own biases based on past experiences with a parent. If a parent has refused or questioned vaccines in the past, you may feel like you're not going to have a productive conversation. That assumption can start you off on the wrong foot. Remember, questions are okay. If you were picking out a daycare for your child, you'd have questions. If your child needed a medical procedure, you'd have questions. It's natural for parents to have questions. If a parent asks questions you don't know the answer to or expresses serious concerns, you can refer them to the provider.
You can let them know the physician or nurse practitioner can provide more information. Then you can share those questions with the provider before they talk to the patient. The background helps the provider zero in on what's more relevant so they can make an effective vaccine recommendation. And if they don't know the answer, they can look into it and follow up with the patient. Let's watch another scene to understand how vaccine conversations in the exam room can play out.
All right, well, while Michael's here for a sports physical, he is due for some vaccinations today. All right, these vaccines will help protect them against meningitis, HPV cancers, and whooping cough. And we can take care of them at the end of the visit. You have any questions?
Well, I'm not sure about the HPV, but maybe he can get the others today and the HPV next time.
Okay. Well, may I ask why you want to hold off on the HPV vaccine?
I know it's a new vaccine, so is it really safe?
Well, I understand. They have done a lot of research on the vaccine ever since it was introduced in 2006, showing that HPV vaccines are safe. And I can tell you that we haven't had any problems with the HPV vaccine here at our clinic. But Dr. Johnson can tell you more about that.
Well, what about vaccine side effects?
Well, as with any medications, vaccines can have side effects like pain, swelling, redness where the shot was given. And that can happen with HPV vaccines too. But they should wear off in about a day or two. Now, sometimes teenagers do faint after they get shots. So we'll have Michael remain seated after his shots to protect him from being injured if he does faint.
Would you give it to your children?
Oh, yes, of course. I made sure that my son got the HPV vaccine when he was 11 because I wanted to protect him from getting cancer in the future.
But how do you feel about waiting until he's a little older?
Well, vaccines protect your child before they're exposed to disease. That's why we give the HPV vaccine earlier rather than later, so they're protected long before they're ever exposed. Also, get you this right here. Look at that. If Michael starts now, he'll only need 2 HPV shots. If you wait until he's older, he may end up needing 3 HPV shots.
I don't know. I'm not sure what we should do.
Well, okay. I see that you're still undecided, and that's okay. Dr. Johnson will be in shortly, and she can address any additional concerns that you may have. Okay? All right. Should be right in.
Thanks.
Dr. Johnson?
Yes?
Hey. Michael McCall and his mother in the exam room, too. He needs a physical to join a baseball team. All right, he's 11, and he's due for Tdap, HPV, and the meningococcal conjugate vaccines. Now, I've talked to his mother, and she's given consent for the Tdap and the meningococcal conjugate vaccines, but she's expressing concern about the HPV vaccine.
What are her concerns?
Well, she mentioned concerns about the safety of the vaccine and she's wondering if Michael needs to have the vaccine right now. I've given her the VIS, and I've explained why it's important to get the vaccine on schedule, but she's still undecided.
Thank you for starting the conversation with her. I'll talk to her more about her concerns.
Okay, sure thing.
Emily, I understand that you have some questions about one of the vaccines that we recommend for 11-year-olds. Can you tell me a little more about your concerns?
Yes. Does Michael really need the HPV vaccine?
I'm glad you asked. Yes. HPV is a very common virus that can cause cancers later in life.
But isn't it more important for girls than for boys?
HPV vaccination is very important for protecting both girls and boys. HPV infections can lead to cancers of the penis, anus, and back of the throat in men.
But he's so young. Why does he need it now?
It's important to give Michael the vaccination now to protect him before he's ever exposed to the virus. That is how other vaccines are scheduled too, so that he has protection before he's at risk. It's like putting on his baseball helmet before he gets up to bat, not when he's in the middle of a swing. That's why we want to start a 2-dose series today. And if you wait until Michael is older, he may need a series of 3 HPV shots total instead of 2.
Well, if you think it's necessary.
I do strongly recommend that we give Michael all 3 of these important vaccinations today. I've had both of my boys vaccinated and my daughter.
Okay, let's do all 3.
Great. Let's get started on your exam.
How does the nurse help support vaccination? What did you notice?
First, this clinic has established a culture of immunization by displaying an HPV vaccination poster in the room. And they prepared the parent by giving her the vaccine information statement to review. Then, the nurse took a presumptive approach. He didn't ask about vaccination. He just told the parent what vaccines they were going to be administering during the visit. When the parent shared reservations, the nurse made an effective recommendation. He listened to the parent and was fully prepared to answer basic questions about vaccine safety.
He also shared a personal story, which reinforces that he sees vaccines as very important. And he filled the physician in on what he learned from the parent so that the physician was ready to have a productive conversation. The physician reinforced that the HPV vaccine is cancer prevention. She was open to the patient and shared facts about the risks and benefits of HPV vaccination. The nurse and the physician worked together as a team to address the parent's concerns so that the child was vaccinated during the visit rather than delaying until the next visit.
Key takeaways. Use the presumptive approach when introducing vaccines. Take the time to learn about a parent's specific concerns. If a parent has questions that you can't answer, refer them to a provider. Following the recommended childhood immunization schedule.
Parents who already intend to vaccinate their children may still have concerns about the recommended childhood immunization schedule. They may ask about delaying some vaccines. It's important to know that CDC's recommended immunization schedule is designed to provide protection early in life, before children are exposed to serious diseases. The schedule provides complete guidance on which vaccines children need at every age, as well as recommendations for catch-up doses for those children that have fallen behind.
Yes. I let parents know that extensive research and testing has demonstrated that the recommended schedule is safe and effective. If parents are concerned about the number of vaccines their child needs during the early years, I reassure them that following the schedule is safe. And I let them know that delaying vaccines puts their child at unnecessary risk for contracting serious diseases.
CDC has created parent-friendly versions of the childhood immunization schedule you can print and share with parents, ideally before the first shot visit. These schedules show which vaccines are needed at which ages. They also explain which diseases are prevented by each vaccine. You can put them in new patient welcome packets, and you can also display them on the wall in the exam room. CDC has schedules in English and in Spanish.
Let's watch another scene to see how nurses and medical assistants can help parents understand the schedule.
Great. Thanks for filling this out. Look at you, Sophia. She's getting so big.
Yep.
You know, she's old enough for her 2-month shots. Today, she needs 3 shots and 1 vaccine that she'll swallow. Did you have a chance to review the vaccine information statements?
Yes.
Great. Do you have any questions?
Yeah, I do. Does she really need all of those vaccines today?
Yes. Vaccines are an important part of keeping Sophia healthy. They protect against diseases that could be very serious for infants.
Is it safe for Sophia to get all of these vaccines at once?
Yes, there's lots of research and testing that shows that babies can safely receive more than 1 vaccine at the same time. Vaccine schedules are designed to provide immunity early in life so that babies receive protection before they're ever exposed to life-threatening diseases. It's safer for Sophia to receive these vaccines now, on time, than to wait. If you wait, she'll remain susceptible to serious diseases.
Okay, well, what about side effects? I heard that babies can have some serious reactions.
Most side effects from vaccines are very minor and go away within just a few days. Now, Sophia may be fussy for a few days, and she may be sore where the shot was given. You can put a cool compress on the injection site, and a little TLC is always helpful. Now, if she develops a fever or you see anything that concerns you, just give us a call.
Yeah, I think we want to just do a couple vaccines and, see how she does.
Yeah.
Can't we, space them out a little bit?
It's very important to start each vaccine series on time to protect children as soon as possible. Children don't receive any known benefits by following schedules that delay vaccines. This handout shows the childhood immunization schedule recommended by the CDC. Like I said earlier, if we wait, she remains susceptible to serious diseases.
And I know she already asked about side effects, but, I've heard about long-term side effects. What about those?
Serious long-term side effects are very rare. The most common side effects from vaccinations are very mild, such as soreness, redness, swelling at the injection site. And some vaccines are associated with fever, rash, fussiness.
Yeah, I'm still not sure.
I understand. Dr. Johnson will be happy to answer any of your questions or talk to you more about your concerns when she comes in.
Yeah, that'd be great.
Okay.
Thank you.
Thank you.
It looks like Sophia has been doing great. Before we start the exam, I know you have some questions about the vaccines that are due today.
Yes, so the nurse told us about the importance of vaccines and vaccine safety, but we're still wondering if we can hold off a little bit and maybe space the vaccines out.
The immunization schedule is carefully designed to provide protection at just the right time. It's important to provide protection early in life, before babies are exposed to diseases and when they're most likely to have serious complications. Delaying vaccines leaves Sophia vulnerable to diseases. To make sure we give Sophia the best protection, I strongly recommend we give all of the scheduled vaccines today.
What do you think?
I think we should go with what she's recommending. I want Sophia to be protected sooner rather than later.
Yeah, it makes sense. We'll go with the recommended schedule vaccines.
How did the nurse address the parents' concerns about vaccine timing? What jumped out for you?
First, the nurse took a presumptive approach to discussing vaccines. She simply told the parents what vaccines their baby would be receiving during the visit. She had prepared ahead of time the answers to common questions, including questions about vaccine safety and the vaccine schedule. When the parent still had concerns after the initial discussion, she referred these concerns to the doctor.
Key takeaways. Assume that parents will choose to vaccinate on schedule. Prepare to address common questions that parents may have. Emphasize the benefits of vaccinating on schedule and the risks of delaying vaccination. Planning for the next visit.
Supporting vaccination doesn't need to end after the exam is over. Another important step is to set expectations for future visits and schedule the next vaccine visit before the patient leaves.
Test your knowledge. You can help prepare patients for their next visit and remind them about their vaccines by A. Making reminder calls, B. Sending emails or text messages, C. Sending parents home with resources, D. All of the above.
Nurses and medical assistants can also bring up vaccines when making appointment reminder calls or sending reminder emails or even text messages. It helps get parents in the right mindset and surface any concerns early. Let's watch another scene to see what staff can do during checkout.
The warrior returns. How was it?
Good.
See, it wasn't so bad, was it?
No.
How's it going, Mom?
Good.
Awesome. Well, it looks like we need to schedule Michael for some follow-up appointments. The second dose of the HPV vaccine should be administered sometime 6 to 12 months after the first one.
Okay.
We also need to make sure he comes in for his flu vaccine. It's important for kids to get their flu vaccines every season.
Is it possible to do both those vaccines at the same time?
Let's see. Looks like we have an opening on October 22nd at 3:45. We can give him both vaccines then if that time works out for both of you.
Yeah, that's great.
Excellent. Here is a copy of the immunization schedule. This explains when Michael should get each vaccine. Have a great day.
Thank you. You too.
Bye, buddy.
Bye.
What worked well in that scene? What stood out to you?
I was struck by the effective process the medical assistant had in place. He knew which vaccines the child would need and took steps to ensure the parent didn't miss visits for these vaccines. He made sure the next appointment was on the books and made sure the parent knew what to expect. He also provided the parent a copy of the immunization schedule to help her prepare for upcoming vaccines.
Key takeaways. Know which vaccines are needed at the next visit. Schedule the patient's next vaccine visit before they leave. Provide educational materials to help parents prepare for the next visit.
Well, Virginia, that brings us to the end of the program today. What are your final thoughts?
Well, above all, I want to reiterate that as medical assistants and nurses, we have a unique opportunity to foster support for immunizations in our practices. We can help implement processes to avoid missing opportunities to vaccinate. And we have the opportunity to talk to parents to help them understand why on-time vaccination is so important. To seize those opportunities, you will need to be well prepared. It's essential to know which vaccines patients need and why. And it's essential to have the answers to common questions.
Definitely. And remember, these best practices help achieve and maintain high vaccination rates for all children, no matter their age. Fortunately, there are many resources available to help. CDC offers a variety of tools and materials both for healthcare professionals and parents. To learn more and download materials, you can visit cdc.gov/vaccines.
Thank you for joining us today for this session on fostering support for vaccination in pediatric and family practices.
Program recap. All office staff, including nurses, MAs, and front office staff, play an important role in fostering support for immunization. Use the presumptive approach when introducing vaccines and be prepared to answer common vaccine questions. Put systems in place to ensure there are no missed opportunities to administer recommended vaccines. For additional information and resources, visit cdc.gov/vaccines/conversations.